Welcome to Innovate and React. In this episode, we will be talking about the intersection between material science and medicine. A great application of chemistry, which is a modern way of accelerating the healing process of bone fractures. Today I'm with Benedikt Kruse. Please tell us a bit about yourself.
Hi, Kevin. Thank you for the invitation. I have worked for 4 years in the research group of Professor Epler at the University of Duisburg-Essen. And in those 4 years, I did my research on calcium phosphate and ultra-small gold nanoparticles. And today we are here to give you a little insight into the calcium phosphate part of my thesis.
Yeah, great. I'm excited that you are here. And now we're looking a bit more into bone adhesives, and then we will see how this will connect to your research. So, what are bone adhesives and what are they used for?
So bone adhesives is like the mystical component that the medicine is missing at the moment, because currently the most established methods to heal bone fractures is with pins, plates, and screws and other kinds of implants that the surgeons are currently using. But this is connected to very high costs because there needs to be the implant material. It takes some time. There's a second operation to remove the implants. And so, this accumulates for very high costs. And our idea was to develop an adhesive to replace these methods and to receive a component that can easily, from the everyday use of any glue, but with specific adhesive properties to bone.
So basically, use these new adhesives to glue the bones together, and then it will heal as if nothing happened.
Yes. And furthermore, it should be biodegradable so that there is no need to remove the implant. But in our case, it will be substituted by your own bone.
Ah, okay. So in the end, nothing of the material stays the same and dissolves. What is happening to these compounds when they dissolve? Are they absorbed by the body or are they just flushed out?
Maybe both. Because as you might know, calcium phosphate is the main inorganic component of our bone. So our bone are composed of calcium phosphate in the form of hydroxyapatite and some collagen as the organic part. Our idea was to use calcium phosphate and to modify it to obtain a similar chemical structure as hydroxyapatite. Of course, since in the body some part of the calcium or the hydroxy are substituted by other cations or anions, we are not capable of reproducing hydroxyapatite to perfection. But since the osteoblasts and osteoclasts, all the cells that are in charge of remodeling the bone, know this product, they can attach to the surface of the adhesive and can remodel it. Of course, this takes some time, but in general, yes, the cells are capable of degrading the bone. Of course, the bone itself, yes, but also the adhesive.
Okay.
And probably in the presence of blood, proteins, and liquid in general, the adhesive will be leaching out to some degree, probably, yeah.
Interesting. So these cells, what were the cells again?
Mainly osteoblasts and osteoclasts. They are in charge of remodeling the bone because bone is not a rigid structure, or it can be seen as a living component. It's there's a ongoing remodeling process of the bone, depending on how strong your bones need to be, depending on how active you are, on your age, on your gender, and stuff like that. and it can adapt to your physical needs.
And these cells then, when the bone is healing, which is glued together with the bone adhesive, they know that this calcium phosphates are useful material and they build onto this, or do they replace it by dissolving the particles from the adhesive and then replace it by, I would say, native bone structure?
Yes, they are capable of degrading the calcium phosphate particles itself. For this, we need the osteoclasts. They digest the calcium phosphate, so to say. And then we have the osteoblast cells, which remodel the bone. So if we look at the interface of the adhesive and the bone fracture, that the cells will invade the glue. And of course, first it has to be degraded, but simultaneously all other kind of cells that usually invade such a fracture, your usual T cells, B cells, and stuff like that. And first we receive some kind of scar tissue, which is always the first thing to be built, since the callus works like a scaffold on which scar tissue is produced by the cells. And by the time passing by, this scar tissue is more and more substituted by real bone produced by osteoblasts. And simultaneously, the calcium phosphate particles are removed from the fracture site by osteoclasts.
Yeah, it's a pretty impressive progress. And how does this compare to conventional type of fixating the bones? When you mentioned plates and rods that are usually used to fix the bones together, how is the healing process in these?
So it's basically the same. You can differentiate between primary and secondary bone healing. We usually aim for primary bone healing since the bone fragments are in direct contact to one another. And when the gap in between the bones is as small as possible, the callus will be as small as it can be, and the cells are able to bridge this small gap. With secondary bone healing, there's a larger gap, and it takes longer for the callus to be converted into real bone. And this has an impact on the stability of the bone because there's more remodeled bone, which is less stable than the real bone itself. And so it takes a little bit longer until the bone has its initial strength again.
But in the end, it will be as strong as non-broken bone in this place.
Yes, in the end, after the healing process has been completed, there should be no difference which method had been used.
Because then the bone, because it gets constantly remodeled, it should basically be a homogeneous structure, more or less.
Yes,
or can you, after years, still tell apart where the bone was broken and where not?
You can probably tell, since there might be some deformation from the callus, like a small bubble on the outer surface of the bone.
Yeah.
But from the stability, there should be no difference.
Okay. Yeah, that's very interesting. I thought always that where bone has been broken, that there's basically a permanent change to the bone. But these cells basically remodel it, so it's one structure again.
Yes, yes. And this is what happens all the time in our body. After every 10 years, all the bone in our bodies have been substituted by new bone.
Yeah, so
osteoblasts and osteoclasts are working all the time at different speed on different sides. As a rule of thumb, you can say that every 10 years you are a whole new scaffold.
great. And that's, I assume, also the reason why astronauts have to constantly use their structure, because, as you said, these cells adjust the bone to their needs, and when the bones are not needed due to physical pressure, then they basically degrade because the cells say, we don't need that much bone in this place right now, and then the bone mass reduces, right?
Yes, exactly. In space, you don't need all your force in the bone, and the bone probably becomes less dense. And when you're back to Earth, this may lead to fractures.
No.
If you spend a long time.
That's, I guess, one of the things that are more known to this field. When we come back to the bone adhesives, the main disadvantage of the current methods to fix bones is costs, as you said, and there are also more procedures. I guess you have to insert the plates and screws into the bone, and then after some point, they are also taken away again.
Yes, that's correct. I only have the numbers for Germany. I don't know how it's on a worldwide scale, but in Germany, I think in 2013, the healthcare system paid around 9 billion euros for the healing of bone fractures. And of course, with an older society, this number will increase and is expected to hit 14 billion by the end of this decade.
Yeah. Interesting. Yeah, that's, I guess, also then when you get older, you don't use your bones as much, and they become less dense, and then they're more prone to fracture. And yeah, that older community will lead them to more bones. So we need better methods to fix these fractures. And what would be the optimal properties one of these bone adhesives should have to be in an ideal world for fixing these problems best?
So of course, such a bone adhesive has to be biocompatible. That means it has to have the adequate properties to stay within the bone, because we do not want to have an immune reaction. The body should accept the adhesive and not remove it as fast as possible. So that's why biocompatibility is important. Also, the material itself should be sterile. This is the main point when it comes to operations. Then we have to have adequate fracture stabilization. Of course, these metal implants provide it pretty easily, but with glues itself, since they are only applied to a comparably small area, since the bone is hollow, it's only the small oval where the paste can be applied to. And another important thing to consider is the healing process. Are there any restrictions when it comes to the bone healing? Because the cells have to adhere to the surface of the glue. They have to work themselves through the adhesive. It has to be vascularized. The application should be as easy as possible, since when you're in the operation room, the operation should not take longer as necessary. So probably an application with a syringe is the best to reach hard to reach areas. And in the end, it should be biodegradable without any toxic metabolites or side products.
If you have immune reaction to this adhesives, it could be that the body degrades the adhesives faster than the bone heals, and then the attachment is lost.
So I don't think that it will have an impact on the adhesive strength, but it might lead to an inflammation.
Okay. And that's always bad for the healing process.
Yeah, but of course, it's in the interest of the patient to get the adhesive out of the body as fast as possible to avoid any further reaction.
And for the application to the fracture, is there pressure needed? I imagine when you have a normal glue to glue, I don't know, some stones together or wood, then you usually apply pressure to the adhesives when it cures.
Mm-hmm.
Is such pressure required with the bones?
Yes, since it's desired to have a very thin surface of the adhesive on one side of the bone, it can be suitable to press the two fragments together to squeeze some excessive paste out of the fracture site and remove it before you close up the wound. So yeah, some pressure needs to be applied. Of course, this pressure can vary from surgeon to surgeon, but yeah, it helps to put some pressure on the site. Yeah.
To again have a minimal distance between the fragments of the bones, and the smaller the distance, the faster it heals, because it has to replace less of the adhesive with actual bone tissue.
Yes, exactly.
Yeah, okay. Yeah, cool. And when we have these properties, so you mentioned the biocompatibility.
It has to be manufactured under sterile conditions, suitable fracture stabilization, easy application, and biological degradation.
Right. And with these properties the adhesives need, what are the challenges when it comes to the adhesive chemically? How can you basically get all these conditions, or what are approaches to manufacture such a material that has all these ideal properties?
Yeah, to have all these properties, one have to unite several properties of different adhesives, because at the moment you can either have a very good fracture stability, for example, with cyanoacrylates or polymethyl methacrylate, so with all the organic adhesives which are already in use, but they come at a cost, and this cost is the biocompatibility, because these are mainly bioinert, but they cannot be degraded by the body itself. But if you have a look from the other side, if you want to have a biodegradable and biocompatible glue, they are not that stable at the moment. So it's always some kind of compromise where you either have a very healthy adhesive or a very stable adhesive. So it's quite difficult to unite all these requirements under one roof.
Yeah. Okay. So it's the best of all can at the moment not be done with the structures. So to get this right, the organic adhesives, they basically do not harm the bones, but they are there and the body cannot degrade them. So the bone tissue is structured around them and it stays where it was.
It stays in the body for the whole time.
Yeah.
And yeah, it will be there.
And this will probably also decrease the stability of the healed bone after, because it's not a uniform structure again. Or is this not a problem?
I don't think this will become a problem, but after a while, this will be degraded to some degree. And often these products, these metabolites, are toxic. And if the concentration becomes too high, this may lead to problems.
And then you also use this problem for your thesis, and how did you try to tackle these problems?
So yeah, our approach was to come from the biocompatible and sterile side, because in our research group we have already established the synthesis of calcium phosphate nanoparticles. So and we knew that it could be synthesized sterilely, and so this was obviously our best starting point. And then our idea was to use catechol molecules, which can be found in nature, in mussels, for example, or any other underwater animal that have shown some adhesive properties. So these molecules are said to play a crucial role in the adhesion underwater. So this was one target molecule. And by the use of click chemistry, we attached these molecules to the surface of our calcium phosphate nanoparticles to bind calcium from the bone. So we have the particle core with the surface functionalization, and these molecules on the surface. And when it was mixed with, first we used water, then we switched to a hydrogel system with alginate. It was supposed to bind to bone, but this did not turn out the way we expected, because we have seen from SEM images that the particle size has decreased after the last reaction step. So that for us, it meant that the particle itself was affected by our surface molecule.
Okay. So by these catechol groups that you try to add. Okay. To break this down, to make it a little bit more easy. So you basically try to attach glue molecules, which are these catechol compounds, which are also found in mussels and sea creatures who use them to attach to surface of ships or whatever. And
yes, exactly.
then you attach those to calcium phosphate particles, which the bone cells can use to structure the bone out of.
Yes, this was the idea. Yes.
Okay. Yeah.
And we
so
also
just
use...
that I understood this correctly and we're on the same page.
So far you did.
Okay, great. And then during the synthesis, the particle size of the calcium phosphate decreased, which was not what you wanted, because why?
Yeah, so we have seen that the particle size decreased, and for us it meant that the catechols on the particle surface were already adhering to the nanoparticles. So the calcium from the particle saturated our catechol molecules to some degree. We do not know if there were still free catechol groups which could adhere to the bone after the application. But we have seen in mechanical testing that there was no extra fracture stabilization with these catechol modified particles in comparison to unmodified calcium phosphide particles.
So they could also do the job somehow, but not as good, because they would not fixate the fragments together as much.
They had only very little fixation.
Did they stick to each other, or did they just each particle was covered with the catechol and you still had separate particles?
That's hard to tell, because since we have a paste, we have a very dense particle neighborhood, so to say. So in all our experiments, we have seen that the particles are close to one another and formed like aggregates. Of course, these could be broken up if the dispersion was not that high concentrated. And for example, ultrasonification was used, but in our case, since the paste is very highly packed with particles, you can only see the aggregates and the reduction of the core size. And another approach was to modify the surface with a peptide. We have found this sequence in the literature, and the sequence was isolated from a protein which can actually be found in bone. So we have used this sequence from our Asian colleagues to attach it to the calcium phosphate nanoparticle surface to bind to collagen in bone. But this comes at a very high cost, even though we have seen an increase in fracture stabilization. We did not want to use the peptide in the end because a few milligram already costs some thousands of euros.
Yeah.
So the degree of increased fracture stability was not worth the high cost.
No. How much would you need for, let's say, you break your wrist and then you have to restructure the bone? How much of the peptide?
Let's say you have it's a clean cut in between the both fragments. We'd probably use maybe 5 milliliters, 1 gram of particle, and 20 milligram of the peptide itself already cost 4,000 euros.
Oh, yeah, okay.
So yeah, it's not really worth it.
For that, you can buy quite some amount of titanium, I guess.
Yeah, it's probably cheaper to use. But since we have only very little fracture stabilization achieved in this project, it's probably better suitable for unloaded fractures like fingers or skull fractures.
So when it's healing, you can remove all kinds of pressure. For example, with the hand, you put it in a cast or something, and then you
Yeah.
don't. Yeah, okay.
Yeah, something like that. So we wouldn't be able to heal a femur properly with what we got, only if you would stay in bed the whole time. But this is also a disadvantage since the bone remodeling is affected by the pressure, the force you apply.
Yeah, interesting. This was were new approaches, and how would you continue with this? Like this whole research, try different adhesives molecules, so a replacement for the catechol to increase the strength of the glue, but the particles, they basically do their job and are compatible with the bones.
Yeah, I think the approach with nanoparticles in combination with hydrogel to me seems very suitable. And yeah, we have seen this now in combination with alginate. And of course, this is a perfect fit since alginate gelates in the presence of calcium, have calcium in the particles. So this was a perfect fit. And maybe one approach would be to modify the alginate further to bring in more stability with that, or have cross-linking agents on the surface to increase to decrease the mesh size in the hydrogel, to have even less water in the network. Of course, this cannot be reduced completely since we need the entrance of water, lipids, and blood for the vascularization and for the transport of the cells. So from starting with our project, I would say the modification of alginate and the cross-linking, the covalent cross-linking of the particles with the matrix, the alginate matrix, could be one approach that could lead to higher fracture stabilization.
So then the alginate basically bridges between the nanoparticles and the bone tissue?
Yes, that's the idea.
Okay.
Because if we'd only used water, the water that entered the fracture site would lead to washing out of the whole paste. So to keep the paste in place, we can use the hydrogel.
Interesting. Because in the surgery, you can not really avoid that water is getting into the wound, and
that's happening on its own.
Yeah, you will always have the water, which is then a problem. Okay.
Yeah, and this can easily be mixed right before the operation. You can prepare the solution, the alginate solution in the morning, and then the surgeon can mix the particles into the liquid phase, transfer it to a syringe, and apply it to the fracture site. So here the application is quite easy and fast. And since it's not hardening or setting, the wound can be closed. And we already have the exact fracture stability you can achieve with this system.
Yeah, that sounds great. So in an ideal world, this would, in comparison to, let's say, a titanium plate that is screwed into both bone fragments, you would only have one instead of two surgeries.
Yes.
When you consider that you also have to take out the titanium parts.
Yes.
And it would provide a similar stability to the fragments, and then during the healing process, the cells can basically use the calcium phosphate nanoparticles to build the bone on and have the blood veins going through it. And then it would also decrease the risk of inflammation compared to conventional methods.
In an ideal world, this would be the case, yes. But, well, we're not at the beginning. This topic has been investigated for the last 70 years, maybe. And so far, no one has come up with an ideal solution to this problem. So this will probably be subject to a few more years of proper investigation by scientists worldwide.
Yeah, but it has a lot of promises, and I think it's worth to pursue further. How long do you think until such a, or what other steps have to follow after you can show in the lab that it works on test components?
Once you have shown that the glue is capable of binding underwater and the mechanical tests have shown good results, at least in comparison to smaller bones, one could probably continue with animal experiments. Well, the smaller the animal, the more difficult it becomes to apply the paste. Yeah, and then I think you would have to go through all these clinical trials that I'm not exactly familiar with.
Yeah, that's a whole new topic then. But there's still some time required, but you see that there will be in the future some applications of this.
Yeah, I think the first application with some kind of bone adhesive can be seen in orthodontology because teeth are no tissue that is alive. So there's no vascularization. And maybe this could be the first step where such an adhesive can be used to fill in a hole in a tooth and then insert some kind of artificial tooth. So maybe a replacement for crowns, but just fishing in the dark here.
Yeah, but there's always the outlook to see what other potential applications for these kinds of materials there are. Yeah, then thank you very much. There was very interesting insights into bone adhesives, which is also a completely new topic for me, but I found a very interesting intersection between chemistry and medicine in this part. So yeah, thank you very much.
Yeah, I totally agree. Thank you for having me. It was a great experience to be here. Thank you.
If you liked this episode, please consider following on wherever you're listening to this podcast. Also, check out the show notes for more informations and my website innovateatreact.com. Everything small and without spaces. That's it for today. Thank you for listening and stay curious.